You're watching CTOM TV. Knowledge is power.
So what is targeted therapy? Well, targeted therapy is the evolution of cancer treatment. Since we've discovered DNA and since we've been able to determine that cancer is a disease of the DNA and that different gene mutations cause cancer, all of the vast majority of the research and the new drug development has been what we call targeted therapies. In other words, drugs that target a specific molecular feature that is unique to the cancer cell. These drugs can be administered, or you can go back. These drugs can be administered in a variety of different forms, intravenous, pill form, and they will specifically only affect the cells that have those specific mutations. In other words, the cancer cells. As a rule, targeted therapies have less side effects than standard chemotherapy. Standard chemotherapy is a class of drugs that what they do is they will interfere with the reproduction of a cell. And they do that in a variety of different ways. Typically, what they'll do is they'll add what's called a methyl group to the DNA so it can't copy itself. And it's like basically putting a cement block in the middle of the road. The DNA transcription machinery and the transposition machinery can't bypass that methyl tag, and then the cell will just break down and get recycled. So that's how standard chemotherapy works. Unfortunately, standard chemotherapy is only active in your body for a short period of time. So if you have a pill or an injection of a standard chemotherapy drug, it's going to kill everything that happens to be rapidly reproducing. So it's not specific. And many of our normal cells are rapidly reproducing, such as hair cells and nail cells, immune cells, cells lining the interior of certain organs. So a lot of those cells will also be affected by chemotherapy, and that's why it has so many side effects. And additionally, chemotherapy, while it is great at reducing the bulk of the tumor, it doesn't actually affect any cells that don't happen to be reproducing. So if you have cancer cells that are not reproducing, such as cancer-causing stem cells, then the chemotherapy is not going to affect it, and it's going to come back after the chemotherapy. And also stem cells, which produce the bulk of the tumors, are not typically targeted by standard chemotherapy. And we can see that when people get chemotherapy and they lose their hair or their nails fall out, as soon as they stop the chemotherapy, the hair grows back. And that should be a good indication that the chemotherapy drugs don't affect the actual stem cells that cause the cancers. Okay.
I just wanted to add this in because I think there's so much stress associated with cancer. I think wherever there's an opportunity for us to feel hopeful, we should take it. And when I came across this statistic, I really wanted to share it with you. Right now, in 2021, in the world, there are 100,000 clinical trials for cancer. That's a lot. And if we understand that what that means is in each of those trials, there's either a new drug being trialed, and almost certainly a targeted therapy, and or new combinations being explored. So if you think about what that means and how many, we can get into how many thousands of papers come out every year in response to this vast number of trials and other studies that are going on. And if we think about each one of those thousands of papers, perhaps providing an option for you or something that's going to be specific to some of the mutations involved in your cancer. And again, every year there are more and more of these studies and more targeted therapies and more options. So right now, we obviously want to make sure you get on the right treatment as quickly as possible, and keep an eye out for all the new developments that are coming over the course of this year and beyond, because they almost certainly will provide improvements.
Yeah, and on that point, Michelle, I think a perfect example of what you're saying here is this mass amount of information. This really is the problem. is this mass amount of clinical trials are producing so much data. There's really not a lot of people looking at it. And that's kind of what our goal is to really sift through this data. But we do it on an individual level for each patient. Rather than doing it for a group of people, they're going to have completely different genomes. We take one person's genome and then we search the data. And I think a perfect example of this is a disease called AML, acute myeloid leukemia. This disease has not had a great advance for many, many years. The same treatments were used, for many, many years, and very dismal outcomes. I think survival was about 1.5 years. Most people didn't do very well on those drugs, and it was just basic chemotherapy drugs. However, in the last 3 years alone, there's been over 13 new FDA-approved targeted therapies for AML. And each one of these radically changes the outcome of the disease. Patients are living way longer now, 6, 7, 10 years, sometimes even cured with these new drugs. However, they are targeting specific molecular features. And if you don't know the molecular features of your AML, you would never know which one of these drugs to use. And unfortunately, these drugs are being introduced so quickly, most doctors don't understand where to give them. And so they will just say, well, we don't have any genetic testing. Let's just try this new drug on this patient. So it's so important to get genetic testing so you understand where you fit in this massive amount of data.
Thank you for watching Cetome TV. Subscribe below and stay informed.